Thanks very much, Andy. We have maybe 2 minutes, Lynn, 2 or 3 for questions. Roland, you
Hi,
were
Andy.
being addressed during his talk.
Roland Griffiths here. I enjoyed your talk.
Hi, Roland.
Yeah, and I think the point you make about acute effects of caffeine having performance and mood elevating effects is well taken. I want to ask you a little bit more about withdrawal suppression, this hypothesis that some of these effects are due to suppression of low-grade withdrawal by caffeine. And you know, as you well know and has been discussed, there are individuals who attribute all the effects to caffeine withdrawal suppression, and that seems radical. But at the same time, it doesn't seem to me it should be dismissed quite as readily as some might dismiss it. So there are, you know, the right methodology for looking at that are these are balanced designs where involving chronic caffeine administration compared to chronic placebo administration. Sigmund published a good study, and there are a couple of others, but that study showed no persisting effects of caffeine under the chronic condition of caffeine. I know you've looked some at that area, and I wonder if you just want to comment a little bit further on that.
I think we could have a discussion on this one for the rest of the day, Roland. But I think to give a brief concluding comment, I agree with you that it's an area that shouldn't be dismissed, and I think the approach which seemed to be coming out of your discussion with Dr. O'Brien yesterday was that there certainly are individuals where withdrawal is a significant problem, and you know, I would be quite happy to go along with that, but equally I don't think it's as you said at the beginning, it's not the ubiquitous explanation that certain research has put forward. So I think what we need to do is move the withdrawal research more down the lines that you've just suggested, and my reading of it in terms of performance changes is that it's still rather conflicting area. Perhaps in terms of mood changes, I'm happier to suggest that withdrawal may be important in that area.
Thanks, Andy, and really appreciate your participation.